For the long axis view of the right kidney, we've got two different approaches, two possibilities. The subcostal approach, where we place the transducer in a longitudinal plane subcostally, and the lateral dorsal approach, where we place the transducer in the right lower intercostal space. In this picture, we can see a longitudinal plane of the right kidney, the renal pelvis in the center, bright and hyperechoic, and the renal parenchyma here at the outside. We can also distinguish the renal capsule, also hyperechoic, over here. Next picture again, a longitudinal plane of the right kidney. This is a younger patient, and in this case, we can see a small hypoechoic structure in the renal parenchyma. These are the mark pyramids. Now we've got a video clip of a scan of the right kidney, longitudinal plane. Again, we can see the bright pelvis in the middle and the parenchyma with its mark pyramids over here. In this structure, dorsal of the right kidney is the psoas muscle. For scanning the kidney, the right kidney in a longitudinal plane, we've got two different approaches. The first one is from subcostally, and it's a lot easier if the patient rolls into a left lateral position. So please turn on your left side. A little bit more, please. Thank you. We place our transducer in a subcostal longitudinal position. And now we take a look at our picture. As we remember, the patient can help us a lot when he's breathing in deeply because the kidney is moving with the breathing of the patient, and when he inhales, it comes a little bit downwards and better into our view. So please inhale and hold your breath. So, and here we already have got the right kidney in a longitudinal plane. I'm going to freeze the picture. Okay, so now we got the renal pelvis in the center of our picture, over here. We can see it's hyperechoic, quite bright, as we already know. And around it, we got the renal parenchyma, very clearly seen here. And also the renal capsule, which can be beautifully viewed over here. When you start to scan the kidney, sometimes you just get a little part of it, just a glimpse of it. I show you. Please inhale again. So maybe you've got some kind of a lopsided view of your kidney. And then it's important to keep the kidney in the center of your view and turn the transducer slowly. Slowly, slowly. Again, inhale and hold your breath. Thank you. Until you get the longest diameter of the kidney. Okay, so again, when you've got this kind of view, a little bit lopsided, just turn the transducer slowly, slowly. Inhale and hold your breath. Sorry. Okay, very good. Turn it slowly, slowly. And now you've got a beautiful view of the right kidney in a longitudinal position. When we've found the maximum length of the kidney, we can take our measurements. So please inhale again. So now I turn the transducer until I'm sure that I've got the maximum length of the kidney. Press the freeze button. Exhale, thank you. And now I will take the length diameter. Let's see. It's 11.7, nearly 12 centimeters. That's perfectly normal. And then the transverse diameter. Over here. Should be between 4 and 6 centimeters. It's 4.6 centimeters, so that's also perfectly normal. The next thing we have to do is that we scan the kidney in the longitudinal plane through the whole organ. So again, inhale please, until we have a good view of the right kidney. And then we tilt the transducer from one side to the other, slowly, slowly, and assess the whole organ. And now we tilt the transducer slowly back to the other side until the kidney disappears again, so that we are sure to have seen the whole organ in a longitudinal plane. Again, exhale and inhale, please. Thank you. So that we can assess the whole kidney in this plane. Especially in the beginning of your ultrasound career, it is very helpful to perform this movement a few times so that you are able to assess all the structures of the kidney and be sure that you have seen everything. Now let's take a look at the surrounding structures of the right kidney. Again, inhale, please, and hold your breath. Thank you very much. The right kidney here in the middle, and this is the right liver lobe. We've got the psoas muscle over here. And now please exhale. And as you can see, now inhale again. The right kidney is sliding all the way along the psoas muscle. Again, please exhale. And now breathe in and out a little bit deeper. Okay. So we can easily see this nice sliding movement of the right kidney along the psoas muscle. Our second approach to the right kidney is from the right lower intercostal space. I place my transducer in the right lower intercostal space in the mid-axillary line in a longitudinal position. Now note that I have to turn my transducer a little bit anti-clockwise. Inhale, please. Just a little bit to get the axis of the right kidney. Exhale again. And inhale. Until I've got a good view of the right kidney in the longitudinal plane again. Inhale, please. When we get a perfect longitudinal view of our right kidney in this approach, in the longest diameter, we start again to tilt our transducer to the left side more and to the right side, so that we can perform a scan, a longitudinal scan through the whole kidney. Again, I show it again to you. Inhale, please. Thank you. Longest diameter. Then we tilt the transducer from one side to the other until the kidney disappears, so that we are sure to have performed a thorough scan to the whole right kidney. The transverse view of the right kidney can be performed on both approaches. Subcostally and lateral-dorsally. In this picture, we got a transverse view of the right kidney. Again, the renal pelvis in the center, the parenchyma with its marked pyramids around here, and the right liver lobe as an adjacent structure. Again, in the next picture, we can see the renal pelvis, the parenchyma, and here a beautiful marked pyramid. Another picture of a transverse view of the right kidney. And here we can see a Doppler signal of the renal arterial vessels. Now a video clip where we scan through the right kidney in a transverse plane. the lower pole, the upper pole over here, see renal pelvis and parenchyma over here. Transverse view of the right kidney. Next, we proceed to the transverse view of the right kidney. Again, the approach in a subcostal longitudinal view. Please inhale. From the same position, subcostally, when we got a beautiful view of the right kidney in the longitudinal plane, we turn the transducer around 90 degrees so that the nose points to our side. Exhale, please. And inhale again. Note that I perform this movement quite slowly. It's anti-clockwise. Nose is pointing to my side. And I keep the kidney in the center of the picture. Exhale, please. And inhale. And now we got a beautiful view of the right kidney in a transverse plane. Exhale, please. Here in the center, again, the renal pelvis. And around it, the renal parenchyma. Capsule of the kidney over here. And now that we've got the kidney in the transverse plane, we also have to scan this organ all the way through. So we ask a patient again to inhale. And now we tilt the transducer this time upwards to the upper pole of the kidney and downwards until we have seen the lower pole of the kidney. Again, I perform this movement quite slowly for you. Exhale first and inhale again. Now I tilt the transducer upwards until I can see the upper pole of the kidney and here the right liver lobe. And now I tilt the transducer downwards again, slowly to assess the whole organ until the kidney disappears. So I know that I've seen the lower pole too.